o'clock. Together every Wednesday, every Tuesday at 1 p.m. we bring you this program, and then it's also repeated on OKFM 99.5 every Wednesday in the morning at 11 o'clock. Like I said, today Health Talk will be talking about a plan. Mano River Union Meeting is scheduled to begin tomorrow. That's on Wednesday, October 19th. We'll be looking at the rationale, the significance, the expected outcome of the conference. We understand the conference will be bringing together some partners and some representatives from the region as well. But in studio we have the director of the NTDs program. He's Mr. Karsor Kollie of the Ministry of Health. Mr. Kollie, welcome to the program.
Thank you so much, Saba.
And also we have Professor Stothard. He's the director, Countdown Project, Liverpool School Tropical Medicine. He's in our studio live. Prof, welcome.
Good afternoon and pleasure to be here.
Okay. And also we have Miatta as Sonkarlay. She's the Medical Assistance Program International Country Program Manager. Welcome.
Thank you, Saba.
Okay, before we join our guest, there's been this report about the re-emergence of polio cases in our country. You know, Liberia has been battling to keep polio out of the country. Not to kick, but to keep it out of the country, because the country has successfully defeated polio for a very, very long time now. But this report, we sought to just call up the Assistant Minister for Preventive Services, Dr. Arzoaquoi, to give us clarification as to how factual that there are re-emergences of polio cases. Welcome to Health Talk.
Thank you, Mr. Judge.
Okay, there's been this report, like I said in my intro. Do you have any idea that we now have some new cases of polio in our country?
No, sir, that story is not true. We do not have any confirmed case of polio in the country. As of this time, we are reporting no, absolutely no.
But it was reported in few of the local dailies that about 2-3 cases were discovered in Nimba County.
Well, polio is one of those diseases that has global public health status. And so we as the nation, we are under international obligation to keep very strict surveillance throughout the length and breadth of the country for the emergence of the disease. So as part of that surveillance, every county health team is under similar obligation to go out searching every home, every hamlet, every community for conditions that look similar to polio. One of those things that we go out looking for is what we call acute flaccid paralysis. That is a sudden onset of paralysis in children, especially under 5 years old. Mm-hmm. So when we see that, we take sample from that child and analyze it to see if it has it conforms to polio. So in Nimba recently, yes, there were children that had acute onset of paralysis, and samples were taken to them and sent out of the country. We haven't gotten any indication that those tests have been confirmed to be polio as of this time. So no.
How soon do we expect the report? How soon do we expect findings as a result of the analysis?
Well, I'm afraid I don't want to give you enough time to be called again, but it should be very, very soon. I can speculate sometimes early next week or the following week.
But all you can say is that we don't have cases of polio that sort in our country.
We do not have any case of polio. And let me sound this far and wild. We are a part of a global community that must report diseases that have global significance, global indications. Polio is one of those, just as we saw in the case of Ebola. There is no way Liberia can ever have a confirmed case of polio and attempt to hide it. Of course, that should never be the case. We are getting enough international assistance, be it finance, resources to ensure that every child is immunized against polio. Every child is screened for any indications of this, paralytic disease. And so the specimen connected is a part of the routine process that we are engaged with as a ministry to ensure that no child is carrying the virus across the length of this and breadth of this country. So until we can have that test confirmed as polio, we do not have any case of the disease in the country. And come next week or next month, we continue to look for cases of paralysis and collect specimens for confirmation. So it's a part of our routine process. We do not have any case of paralysis, any